And I know from the work I've been doing, there's so much information out there. I think one of our biggest challenges is how do we consolidate and digest and interpret all this information. So I have made efforts to provide you with research-based and sort of best practices information for today's presentation. So if you don't mind advancing the next slide there. So we will break this into 4 groups. So I'm going to give you a little bit of an overview, again, just to remind you of what we're dealing with this new infectious disease called COVID-19. So some core concepts that we have to keep messaging to our staff and also to us so we're clear on what it is we're dealing with. Controls related to the workplace, controls related to employees, and at the end of this, there's resources as well, just some of my sort of favorite picks, and then as well, we'll have time for questions that you may have. And I also should comment that I did take a look at the guest list that we have here today. It's about 125 roughly of you. And you're from all different sectors, and a lot of people from sort of child care, community care. I see some long-term care partners. A shout out to some clients that I deal with on a regular basis, especially in municipal government. And then we have a whole host of people that sort of fall under the education sector as well, and then some other really unique firms. So thanks for joining us. And I think because of the broad audience, this hopefully will be informative to you. Okay. So let's dive into some of these core concepts. So the next 2 slides are really a refresher about what's going on with this pandemic. And again, just a reminder, pan means around the world. So this is something globally we know we've all been dealing with. We'll take a look at modes of transmission. And I just want to sort of set the stage with reminding you that with every other hazard that you've had to deal with within the work environment, whether you're, say, a Joint Health and Safety Committee rep that's joining us today, whether you're a frontline worker, whether you're management, whether you're owner of an organization, it's like every other hazard we've had to deal with. So workplace violence, ergonomic related hazards. There's a process that we ought to use to address. So I will touch on that. Okay, and the process is, in fact, the RACE model. So how do we recognize, assess, control, and evaluate hazards within our work environment? And also, how do we separate that from risk, which is 2 different things? So to recognize, first of all, what we're dealing with, here's the breakdown of what COVID actually stands for. I don't know if you've seen this anywhere. It's not widely out there, but it's interesting in that what it stands for, the CO for corona, VI for virus, D for disease, and 19 for 2019. So this, as you know, this is a new disease, hence novel, and first identified in Wuhan, China. And that's where the outbreak began. And it's also important to kind of understand that coronaviruses are not new. In fact, they've been around for years and years and years, and they're a very large family of viruses that are known to cause respiratory illness. So COVID-19, does cause respiratory illness, ranging from something more mild, like a cold, right through to something serious, and up to fatalities. And this is also, we've seen other novel coronaviruses, so things like SARS, that was in fact a novel coronavirus, as was MERS, so the Middle East Respiratory Syndrome. And I always reflect on something that a wise biology teacher of mine taught us years ago. In fact, I was thinking about this in the car today. It was around grade 10 and grade 11. And she sort of made a statement that I still remember today, which is we ought not to, focus on some of these major things around war and trauma going on in the world. We really need to be thinking about viruses. And I thought that's a very odd statement, but what she meant to say, and as she illustrated her point, is that viruses are very smart. They're simple, right? A simple organism, yet really smart, because they can reproduce themselves, they can exploit hosts and change DNA. So this is a challenge. Viruses are tricky, and hence that's why we don't have any kind of antiviral as yet developed. So it takes some time to do that. Coronaviruses are found in a diverse array of animals. You likely know that. So bats, bird species, and those types of animals are believed to act as a natural host for this type of virus. And if you look at sort of the molecular clock, if you can call it that, we can see that the coronavirus dates back to 10,000 years ago. So it's COVID-19 is called a novel virus, so that's new, but coronavirus itself is not new. Okay. So modes of transmission is the next slide that I'd like to spend a few minutes on. This was very confusing at the beginning, I think, for people. They struggled. They saw images in the media with people sort of head to toe personal protective equipment. The questions came in fast and furious about what should we be wearing? You know, should we have gowns? Should we worry about our footwear? And people were really quite fearful and quite panicky. And I think a piece of that is we were trying to very quickly figure out what is the mode of transmission. So here's what it is. And again, most of you will know this by now because it's not new news, so to speak. So droplet and contact are the two big areas. So when we say droplet contact, what we're referring to there are respiratory droplets that are generated. If I were to cough and sneeze your direction, those droplets are suspended for a period of time in air. Fortunately, gravity works against them and they will settle, so that's good. And then as they settle, perhaps it settles on a desk surface in the work environment. Another individual might come along and touch that contaminated surface if I have COVID and I've coughed and sneezed on that surface. And then they may touch their eyes, their nose, their mouth, so all mucous membranes. And then that person subsequently contracts this infectious disease. So those are the two things that employees have to remember is how transmission occurs. And we know that the majority of cases have been linked between person to person. And we shed most of the virus just before symptoms appear. So hence, how much thought goes into concern about person who's symptomatic as opposed to asymptomatic. So, understanding all of that. The other thing too with droplets, and I know we have some healthcare folks with us today, but this presentation is really geared predominantly to non-healthcare settings. So with respiratory droplets, I just want to make the distinguishing feature that aerosol droplets, that is a type of droplet, but aerosol droplets we are more concerned about in healthcare environments. And it's things like endotracheal tubes or intubating a patient where you're right close to them, right close to their respiratory system and vice versa. And if they're ill, there are certainly risks there for us. We're not doing that in municipal government. We're not doing that in education sectors, in childcare settings. So airborne droplets is not a concern in those areas. It's really healthcare specific. Okay, so for the majority of us, we need to be thankful that if a person is infected with COVID, if we're far enough away, they cough, they sneeze our direction, gravity is going to work to lower those infected respiratory droplets. Okay, so that's on mode of transmission. So what about then workplace? So what should we be thinking about in terms of our action plan? So if you don't mind advancing that next slide. So I mentioned earlier, we need to be thinking of this type of a biohazard, you could say. When you look at the different categories of hazards, you could cluster this under biohazards. So we look at this like every other workplace hazard. And the way we tackle that is by using what's called the hierarchy of controls. So if there's any occupational hygienists out there, any safety professionals out there, hierarchy of controls you ought to be familiar with. And for the layperson that's not ever studied this, this is actually a very, very helpful tool to tackle issues, specifically COVID or other hazards in the work environment. So the first question we need to say in the workplace is, can we eliminate this particular biohazard? No, maybe not. But what we can do is eliminate face-to-face contact between workers and say clients, or limit that, as we have currently been doing. And just something of interest, I was looking at some data coming out of University of Guelph, and what they said is prior to COVID-19, 60% of Canadians had never telecommuted. And at the same time, we've realized that with telecommuting, the research shows that it creates a household surplus of $7,000 a year per telecommuter. And this is for data from Southwestern Ontario. And obviously the savings is from not having to drive back and forth. So with elimination of the hazard, there's that silver lining, which is, there's been countless numbers of individuals that have frankly saved money. Research shows that from telecommuting. Okay, so we physically removed ourselves, and we've, in essence, been just sort of isolating in our own homes. Okay, so that's how you can think of elimination. With substitution, we've also been getting very well versed with video conferencing as an example. Engineering, we've heard lots around barriers. We've seen that out in the grocery stores. Those went up rather quickly, where we isolate people, say a worker, from a potential hazard of someone doing their groceries that by chance is asymptomatic with COVID-19. Administrative controls, there's quite a list of things that can fall, as an example, with any hazard under administrative control. And the common ones that ought to come to your mind are things like policies and procedures, as an example. Okay. Other administrative controls specific to COVID is that simple messaging around hygiene measures, hand hygiene. Okay. And personal protective equipment. So this is where sort of a real message, a real takeaway message to remind ourselves about is PPE is always the least effective type of control. However, in some situations, like in healthcare, it can be the only control. So think of all biohazards. We can't eliminate all biohazards from the face of this earth, certainly not from a healthcare environment. But, we do have to be thinking about the personal protective equipment that our frontline healthcare workers have to don and doff. Okay, so, but know that if we just were to say, okay, the way we're dealing with COVID and getting people back to work is purchasing all this PPE and getting them to basically wear a suit of armor in the workplace, that is not the best measure or a logical measure at all. Okay. I will, though, talk about appropriate PPE in relationship to COVID-19 today. Okay, so that hierarchy of controls, again, that's how we tackle all hazards in the work environment. It's a way you can critically think through this particular hazard and always be going back to things like, can we engineer it out? Can we substitute, or can we eliminate through different measures? Okay, I'll just get you to switch slides there for me. So this is a slide where, again, all the work that has been asked of us over the last little while, I've kind of clustered it into these particular categories and split that between what can we do in a work environment, what's really directly in the employer's control, and what can we do as an employee ourselves. So I'm going to go through this, and hopefully you'll be jotting down some notes that help to complement your action plan. I don't have a long period of time to go into a ton of depth here, but feel free that after today, if there's pieces that you need more information on, we're here to help, and just a matter of reaching out to us. Okay, so with the heating and ventilation and air conditioning, that if you've been following the research around that in the early days, ASHRAE, the American Society for Heating Refrigeration, they came out with like a long list of here's what to do with COVID, and we sort of waxed and waned from that. So my best information that I can provide you today is not to forget about simple things like Mother Nature, and how beneficial it is just to get outdoors. We always say that, fresh air and sunlight, and when I say we, that's really nurses. In the old days, we would say to our patients, fresh air and sunlight is a medicine that we can't bottle. And it is so important in the context of COVID that, why not get creative? Can we have meetings out in say, a courtyard where we've spent some money and it's a wellness promoting environment? So get out into that fresh air. So how do we optimize that outdoor air ventilation? Can we open windows in buildings? Today I was at a commercial establishment, and right away, walk in, tons of fresh air. They had a little side door open. It was beautiful. So, this is a very, very, very simple measure that we should be taking. And in fact, it sounds so simple, but certainly backed up in the latest guidelines and research that we're seeing. Okay, so where appropriate, use outdoor spaces, optimize outdoor air ventilation. Um, you can look at improving filtration. There is some guidelines from ASHRAE. They talk about MERV 13 filters. It's getting pretty technical, but you can speak to facilities folks and find out, what are they seeing in their professional realm around specifics like filtration. Also, review the length of time that you've got your systems up and running. If you're spacing out shift workers, as an example, and you now all of a sudden have people coming in on weekends and the ventilation's shut off completely, obviously that's not good. We've got to reconsider that. Okay, so really partner with facilities, infection prevention and control experts, occupational health and safety experts, engineering, building owners too, and watch the emerging sort of control strategies that are coming out. And it really keep your finger on the evidence that's being passed through those circles. Okay, so the evidence again is mixed, and use logic, fresh air, keeping the systems running at an optimal level, making sure temperature is good and humidity is not too high within the work environments. Okay, shared work areas and equipment. So lots of you here joining us today will have shared work areas that are coming to mind and equipment. So even something like photocopiers, as an example, all of a sudden we're going to start to see in the work environment, say, disinfecting wipes right beside a high touch piece of equipment and shared equipment such as photocopiers. Okay, so we need to think about what is shared, what does have high touch, high use by all workers in the work environment, and then how is that equipment cleaned and disinfected? Ensure things like meeting rooms, as an example, have a good supply of disinfectant wipes. This is all in all the best practice guidance that you see out there. Tools like whiteboard markers, all of a sudden we're having to think about, okay, are they ever cleaned? How do we clean them? And also be thinking about point of use, like making it easy for workers to be able to do that themselves. Okay, this is not all on facilities' shoulders. We are all part of the internal responsibility and all have a role to play with this. Meeting room density maps are a good idea. So limiting the number of people that are allowed within meeting rooms. Okay. And also, is there a way to start to think about direction of flow into areas like meeting rooms? Is there two doors? So one's in and one's out. So these are just really practical infection prevention control strategies you might be able to look at. There'll be other areas like bike rooms, lounges, common areas, and we are at a point of history where we have to be thinking about enhanced cleaning measures for those areas. Serving refreshments. So I think what you're going to see is, for an example, now they're starting to open up barbershops, hair salons, places like that. I think, maybe your hairstylist offered you a cup of coffee. You're not going to see that anymore. So in areas where we have people gathering for the short time frame, like in the future, yes, but in the short time frame, we need to be thinking about, is that the best measure to be serving refreshments in areas where we congregate or meet? Okay. And then communal items, if you have waiting rooms in your work environments, what do you have there? Do you have magazines? Do you have newspapers? Do you have journals? Candy bowls, all those kind of things we need to rethink. And why that is that contact piece. This is the one of the main ways in which COVID-19 is transmitted. Okay. Food services, food prep areas. Although we see in the literature that food is likely not a source of COVID-19 spread, food handlers themselves can be. So we have to make sure and re-educate around proper, coughing, sneezing, hand hygiene, etiquette, that type of thing. So making sure they're trained on how COVID-19 is transmitted and preventative measures. You're going to probably see a lot of buffet style restaurants or buffet style food areas within a work environment change. And it's going to be more control where one individual's with a gloved hand is going to be doling out food portions. Okay. And cleaning and disinfection, just something that might be very helpful to you because we are, even before COVID-19, I do always remember a woman I had in a training session of mine. She was really entertaining and she had us all in stitches. She was a new Canadian and she talked about how she totally went overboard with her first grocery shopping, and she bought a type of cleaner for every surface, every piece of equipment in the home because she had moved from Brazil, and she said there, we had like one cleaner, one multi-purpose cleaner. Here you've got cleaners for fridges, for stoves, for, hand washing, antimicrobial this, antibacterial this. So it is a bit of a nightmare to figure out where do we begin with this? What do we use to clean? And then what do we use to disinfect? And we farmed a lot of questions in this area as consultants. So my best advice to you is to go to Health Canada if you've already not. And there is a comprehensive list of disinfectants and cleaning products that are appropriate and shown to kill COVID-19. So these are the products you want. You just don't want something you ran out and bought because you saw, good supply of it at, say, the dollar store. You want to make sure you've got an efficient product that does target COVID-19. And so again, Health Canada is a site you go to for that. You need to make sure that these products have a DIN number. And if it's on a DIN number or drug identification number, I'm just trying to remember, it's NPN, so natural product number as well. So again, this is listed on Health Canada's site. So some of you might have gone more green. You have children in your work environment. Maybe you've got different types of chemicals to consider, allergies for children, etc. So definitely check out that information under Health Canada. Okay. Now the only exception of what you won't find there with a DIN number is household bleach and alcohol. So you can also find information on Health Canada's site for the alcohol-based hand sanitizers too. Okay. So and just again, a bit of silver lining as it relates to COVID-19. If you have knowledge around the different types of pathogens out there and how hard are they to clean or sanitize or disinfect, the good news is that COVID is actually really easy to clean and disinfect. We're not talking about a spore. Spores are up here. Spores are very hard to kill. So healthcare, you are challenged with spores. I think C. diff falls under this category. The next category down, if I remember correctly, is the mycobacterium. So tuberculosis, really difficult to disinfect and get rid of, whereas COVID is way down. It's an enveloped virus, it's called, so quite easy to clean with the solutions that Health Canada recommends and disinfect. Okay, and cleaning and disinfecting are two different things, right? So we need to educate our staff around that. Okay, just as an aside, the cleaning is really to break down grease, remove dirt. And the disinfectant, if you use products appropriately and apply it for a long enough period of time before quickly wiping it up, these disinfectants will kill germs as we know them. Okay. Wipes, we are getting lots of questions about the efficacy of wipes. So know that they are not meant for routine cleaning, but they are good, to have on hand. And again, that point of use, they're readily there so that workers are more apt to use them. Okay. And they're very good for items that can't be soaked or for smaller items that must be disinfected between uses. So again, just thinking of the people that are joining us today from a childcare type environment, you may have really good purpose for wipes in that regard. Okay. Handheld devices, electronics, monitors, keyboards, also very useful to have wipes for that. Okay. And I'm sure you have already thought of installing the alcohol-based hand sanitizer dispensers within your environments, and they're I know on short supply. A lot of our clients have had trouble getting them, but get your order in would be my message there. Okay. Um, and just think through things. I was in an environment today, and someone asked, "Is there anything else you'd recommend, Liz?" And I said, everything was fine. They had everything in order, but just something simple. I said to them that's not really costly is even like waste containers that are sort of foot operated, as opposed to having to touch the lid, open it up, and then dispose of gloves or wipes, etc. Okay, so practical things. All right, and then finally on this list, delivery and mail. So I'll show you a slide in a minute. I think people in the earlier days got really panicky. There must have been something released in the media around cardboard, of all things. So I had a number of questions around cardboard. How long can COVID live on cardboard? How do we handle UPS deliveries or courier materials? Should we leave them outdoors and let the frost get on them for 48 hours? And all sorts of questions like this. So, we do need to have some degree of precaution in handling products like this. But again, if you're concerned about any of this kind of thing, soap and water works great. If your workers are really nervous, they're not the be all end all, but you could implement something like that. You might want to check with the parties that are delivering the products, what kind of protocols do they have in place? And again, most of the time, by the time that product delivers, like even if you have COVID-19, you coughed on a package, it goes through courier, you're talking 24 hours, 48 hours, and it will really, statistically be a non-issue. Okay. This does also cover the category around vehicles that as employers you may own. So how do you manage those? How do you clean them? Whose job is that? How can we make it easy? How often should that occur? So wipes work really well. Maybe vehicles can be assigned to one or two individuals. You really need to figure that one out, like operationalize it. But I'm I can tell you, yeah, you do need to think about cleaning of those. We've had clients, because we deal with municipalities a lot. We've had clients also implement barriers like plexiglass or acrylic barriers within work vehicles, say like a roads department. So those have been interest in those. Okay. The other thing too, just since I'm on the vehicle piece, I guess we had one situation where it was an employee that had been really cleaning their vehicle and tried to get the employer to compensate for damages to the vehicle because the leather steering wheel was ruined using wipes. So now I see that on like basically any of the automakers, so Ford, GM, any of them, you'll see guidance around how to clean personal vehicles produced by them. Okay, and the last thing too, it's a little outside of delivery and mail, but if you have people that are driving in a work vehicle, or even like myself, I'm a consultant, employers are starting to put together what we call travel kits. So these would be kits where it's personal protective equipment. It's things like a surgical mask, alcohol-based hand sanitizer, right there ready for those types of mobile workers. So don't forget about that with your planning. Okay, next slide.
Thanks, Liz. And just from a timing, we have about 3 minutes before we go
Okay.
into Q&A, please.
Okay, great. So this is a slide that is based on Chin's work, and you need to keep this in perspective. This is in ideal situations where they could create an environment where they are testing to see how long COVID will survive. So again, ideal situations. But in the outside of a surgical mask, that's more in a healthcare environment. Very interesting, and also drives home the message around how important it is to properly don and doff surgical masks. And yeah, so you can see that information there. Next slide, if you don't mind, Patricia. Great. Employees. So what I want to just talk about here, that I mean, limit number of employees in the workplace, limit number of employees in break and communal areas. That's pretty much self-explanatory. I cannot underestimate the importance of physical distancing. So when your employees get really, really concerned and you almost hear, a tone of fear in their voice, the first thing we need to think about, because of the way this virus is transmitted, is keeping our distance from clients and from each other. So that's number one. Um, Number two is hand washing. So, so important. And then the very last thing, again, if you can think of that hierarchy or that triangle, the last thing is the personal protective equipment. We do have to know what's appropriate. And I just want to take a second here to differentiate between, masks. This is where we're getting a ton of questions. So surgical masks or medical masks, whatever you want to call them, it's a wee bit of a misnomer, right? Because, you know, um, surgery is we think of healthcare environments, but we're wearing these types of masks in the community. There's surgical masks, blue on the outside, perhaps a lot of them are made that way. These are fine, but what the employee has to understand is that the reason they wear that is not to protect themselves, it's to protect another person. So if I have COVID and I'm symptomatic or asymptomatic, if I cough into my surgical mask or a cloth mask, I am protecting the person across from me. Okay, it's not protecting me from community. So that's very important to make that differentiation. Okay, and people really have to understand that. Okay, uh, so gloves are N95s. Since we're on masks, N95 masks. Um, I'm embarrassed to say, frankly, that I know there's a number of work settings that have kind of hoarded and stockpiled these, and they're meant for healthcare. And we've had such shortage, right? We heard that in the media, and they're tight-fitting masks, and these are for those types of situations where we're worried about airborne droplets. Okay, so intubation as an example. So N95s, you shouldn't be really, for most all of you in the audience today, be thinking about how can we get N95s, how can we get everybody fit tested, is really strictly for healthcare environments. Okay, gloves, definitely wear them when there's that chemical exposure. So as you're doing more cleaning, disinfecting, but they are not considered a primary control to prevent COVID-19 in non-healthcare settings. And in fact, gloves can put workers at higher risk. It's almost like a false sense of security. They can take them off improperly, and they're less inclined, and we know that from the research, they're less inclined to wash their hands due to it being gloved. Okay, and then also my last point here is two last points. Take a look at your HR policies. Um, I really do think we need to, the whole strict attendance management type process, we need to rethink that. Obviously, with COVID-19, we do not want to force people into work if they're not feeling well. So take a look at your policies and procedures. If you have questions, reach out to us. And my very last point here is don't forget about employees' mental health and the primary prevention strategies they can take to make sure that they continue to be healthy and safe in the work environment. We've got some great resources on our website, so information sheets, guidance for both employers and workers. So do take a look at what we have available. And there's, I think, one more resource slide there for you. These are sort of my top picks. The Public Health Ontario are great. Lots of risk information, lots of information around donning, doffing masks, very short 1-minute video clips you can use for education in your work environment. And also BC Medicine, it should say there, they did a whole COVE Ed, sort of a pun on COVID, and a whole bunch of interesting YouTube videos, including the importance of social distancing. So that's it. And I just would like to take a second to open things up for questions or hand it over to Patricia. Can you hear me okay, Patricia?
Sorry, I was on mute, so my apologies. So
No
thank
worries.
you, Liz. That was very comprehensive and informative for all of us thinking about returning to the workplace and keeping us safe, so that we can definitely benefit from that information. So thank you so much for that. And yes, just monitoring some of the questions coming in. There's questions about accessing slides. The recordings of each session are available so almost within minutes of us closing out the session, that you'll have access today and after the conference. One of the more specific questions, I think, Liz, related to the presentation was just around resources on cleaning and disinfecting. So just maybe suggesting the resources for them to access if you have one or two that can provide some guidance. I saw a couple questions and themes around cleaning and disinfecting.
Yeah, sure. That Health Canada site, if you just, it's on that last other resources. If you just do a search for disinfection of hard surfaces, that's an excellent document, and that'll lead you into the disinfectants with the DIN number. So go to Health Canada, and disinfection for hard surfaces is what you want to be looking for. If you have any problems finding it, just my email's there. Drop me an email. I'm happy to send that link to you.
Great, thanks, Liz. I also know in some of the COVID guides for employers and workers, there is a cleaning and disinfectant section in those guides as well. So it's possible you may find what you're looking for there and links to the information that you could potentially look at as well. I haven't seen any other specific questions come through chats. A lot of thank yous and great presentation and great information, Liz. So I just want to say again a thank you to Liz for sharing this information very timely as we start to reopen the province of Ontario and returning to the workplace. So thank you so much, Liz.
You're very welcome, and everybody, thanks for your participation, and give us a shout if you need any help in sorting through all this. Appreciate everybody's time.
Thanks, Liz. And just as a follow-up to this session, to let everybody know they can visit the trade show and the research expo, which is open all day. And right now you can go and learn about some research from Dr. Melissa Jeanreau from the Department of Community Health Sciences, Faculty of Medicine and Health Sciences at the University of Sherbrooke. The research is on the role of communication strategies and media discourse in shaping psychological and behavior responses to the COVID-19 outbreak, a comparative analysis between Canada and 2 Asian countries and regions. Also, there will be more sessions coming up at 3 o'clock that you can make your selection and be sure to join in another session before the day ends. Thank you and enjoy the rest of your day.
Thanks, Patricia. Thanks, Dave.
Bye.
Bye, everybody.